Welcome back to another episode of Vitals and Values, and we have our first guest. And I can't be more excited for this. We got a high five because we're all in the same room right now. High five. High five again.
It's our first guest
In
person, you
person.
mean.
That's what I was looking for. And I think it works the best because Seth and I go way back. We didn't really know each other that much in high school, but then obviously we both went to CMU together. And this episode is on the at least, and it's funny because we preface this of like, it just seems from my point of view, there seems to be a bigger polarity between chiropractic physicians, and there's like an animosity to it. And I think it absolutely is crazy how we've created so many us versus them mentalities when it comes to politicalness, medicine, all this kind of stuff. And from a perspective of quality of health and quality of life, I want to shout out Seth off the bat when it comes to my dad. My dad's had back problems his whole life, and he saw Seth about 3.5 years ago. And he worked his protocol through him, working on a low back process of how you open your hips up and how you move. And it starts with the ground and comes up. And my dad to this day still religiously does your program. And he hasn't thrown on his back in 3.5, 4 years. So it's been really cool to see that and appreciate that all. And so this is a touchy subject because I also have to acknowledge I get in a lot of debates with chiropractors saying some reckless stuff on the internet. And it's going to be a fun conversation. I'm looking forward to talking about what made you decide to go into chiropractic. What was that process like? We even talked about way before this, like the whole triage method. I never even thought about the way you explained that. So I'm looking forward to this conversation.
Yeah, do you want to go, like, how long have you been practicing as a chiropractor, and why did you go into it?
Yeah, this is my sixth year in practice. Yeah. Why did I go into chiropractic?
I know I hate that question when people ask me as a physician.
I had no idea. I didn't know I was going to be a chiropractor until I like applied to chiro school. Yeah, I was like, maybe this is the way. Injuries all the time. I was hurt, like growing up playing sports, shoulder and hip and low backs and this and this and that, and like go to PT and chiro. And then I got into strength conditioning, and I actually worked for Eric Delamelier over at Chiro Unlimited. And I just started to see it's like, all right, it's not like he's not just doing the manipulation and sending you on your way. It's like there's some stretching to it. He's doing some soft tissue, and he's like, all right, train with these people, get stronger. This is going to help out. And I was like, oh, I think that's what I want to do. Like, I think I can help people a lot with that. And that pointed me back into going to chiro school. And I think I got into it and was like, oh, this is going to be like the magic way. Like, you're going to go, it's cracking backs and like, you know how to set stuff, and then it's magic and it's good. And you start learning, you go, oh, that is not the case. No, it's still assessment process, and it is a lot of medicine, and the ability, like David said, to triage your patients and go like, can I even help you? Like, are you in the right office? And then figuring out like, what system are we talking about that's actually being affected? That's so like, right, like, should you be in my office? Do I need to send you over here to handle some kind of systemic issue, or it's an internal medicine issue? Like, what is happening? Or is this actually musculoskeletal? And then I found CrossFit, and I was like, oh, it's working out. Like, it's training. It's all about movement and like how well the body moves and how efficiently. And then rehab has just become this like stepping stone. It's like, if I can understand the process, like everything is technically rehab. Well, it's not. I don't love that term. I mean, you're not always trying to regain a skill.
Rehabilitation,
right?
you don't like that term?
Well, I mean, in training, when people are like, well, it's prehab, right? It's like, well, prehabilitation doesn't really make sense. Like, that's kind of an oxymoron of a term for it. Like, we're not prehabbing anything. We're prepping joints and tissues, sure. But other than that, it's like, okay, well, why is that dysfunction present? And like I was saying, like, I think in physical medicine, especially, like, we're talking about three big issues. Is it what people think of as chiropractic as in like an alignment bone thing, and I've got a joint discrepancy problem? Is it like a soft tissue issue, right? I like that term. Or is it like all the fascial stretching we're seeing, right? Like, yeah, stretch lab down here, and people are getting stretched out all the time. Or is it a coordination problem, and it's just like my organization of the task is not good? And then what's the combination of those things? High school kid, mostly coordination problems. and some joint discrepancy, some coordination, not a lot of true soft tissue issues. And then you get your older and older patients, and we have actual changes that are occurring. And now I'm going to have to work on this tissue. I have to stretch this out or strip this tissue to give me some room to then try to re-coordinate the exercise or the movement. And that could be anything. Like I can't squat, I can't lunge, I can't put my hand over my head, my neck doesn't work, I have sciatica, I have plantar fasciitis. Doesn't matter. It's like they're all coming from the same system of stuff.
Well,
Yeah.
I think it's real quick on that one. I think it's kind of funny too, because where you discern it well. For anyone who's ever watched a video with me, I have a jacked up left leg.
Yeah, it's wild.
It's wild. It's what's called a valgus knee. And I remember going to Seth with it, and we worked on some things, but at the same time, even you were like, oh yeah, this is bone. This is just weird. You're going to be doing some things different than everybody else. Now, I even pushed the needle further, got the MRI, talked to an orthopedic surgeon, and crazy enough, surgeons love to do surgery. It's a weird concept. And I obviously got Seth's perspective. I got a PT's perspective. I got a surgeon's perspective. And I was like, I'm not in pain day to day, walking, golfing, doing certain things. So why would I go through a surgery that could potentially cause long-term pain when I'm not in pain now? So like, I remember taking Seth's advice. I'm like, just do what you can, just keep range of motion, do the best, like work through it as effectively as possible. But having a surgery just because to have a surgery is not always the right move.
Yeah. You can always go back and have it done.
Yeah, exactly.
Yeah. It's hard to undo it.
No, like I grew up in a family that didn't ever go to chiropractors. And my only like thought of a chiropractor was, yeah, they crack your back and then you go back every week.
Yeah.
So it's training, or just how does it end up that you do what you do, which sounds more almost like a physical therapist, but versus the people that are like just getting their back cracked every week?
Yeah. It's a lot like medical school where like there's a general training and we're all trained like how to manipulate and palpation skills and these types of things. But then you can specialize into what you want to do if you're going to do more. Because in Illinois, I'm in primary care. Like I can do whatever I want. I can't write prescriptions. I took all the farm and everything.
But you can't write.
I can't write.
But you can do everything else.
I can do everything else.
That's crazy.
Yeah. It's wild. Yeah. Phlebotomy and all this stuff, like no problem. So there's a lot more designation into more internal med, and especially in some of these states that have more rights. And when you think about like some of the populations you're treating, Amish population, like they're not coming to MD. Like, and you better know like some internal med or you're going to hurt people. Right. So there's a lot of pressure on it. I think you if you're not paying attention and you only have this tool of manipulation, you come out and you're just hoping that that's going to be what you got. It's like the term, like if all you got's a hammer, everything's a nail. Right. And I think it just misses I think school just misses the rest of putting it together. It's like all treatment. It's like, yeah, manipulation is a great tool. Palpation is a great skill. If you can apply them well, you're going to get people better sometimes.
So these people, like some of these chiropractors are just doing manipulation, you're saying? And then.
Yeah, there's definitely some of that.
Ooh.
Yeah, I think if you look at reimbursements models too, it makes a lot more sense.
Okay.
Like you start following the insurance rabbit hole and like.
Wait. So insurance. I'm seeking a pattern here.
And I don't want to say that everyone's there solely on insurance models,
Sure.
But to think that it's not happening at all, it's like, no, like, come on now.
Are you saying manipulation is like more reimbursed than other?
Yeah, and it takes 3 seconds. Yeah, my reimbursement for like if I want to do like spinal manipulation to send you out the door, it'd take me 5 minutes and I could bill $85 for sure, all day, easy.
Okay.
So, I mean, when you're putting on the pressure, school's expensive.
Mm-hmm.
So, I mean, I don't blame anybody. And I really think that a lot of chiros do really think that's the best thing to do. It's like, it's alignment. It's a little bit of an old school mentality of like, I'm going to align the nervous system and that's going to provide an opportunity for the body to go through healing processes. It's like, sure, I'm all for that. But I think it's just the first step of assessment. Where it's like, if my assessment process is this is stiff, what do I know? I don't know anything from that. It's like, it's probably still stiff next week, right? And sure, it pops, like whatever. Like, are you stronger? Like, are the trigger points gone? If your pain is better, like how long did it stay better? And pain is not even a good representation. Maybe you're just having a terrible day and your pain is through the roof. Maybe you're having an awesome day and your pain is really, really low, but every other symptom is the same. So if that's the assessment process of this is stiff and I'm going to blast this thing and then you're going to feel better, like that's a very low level of treatment in my mind.
I mean, it's no dissimilar to when you're in insurance-based primary care. It's like, you're getting pressed, and it's like, all right, I gotta go to the pill. I got 6 minutes, so it's like we can't really dive into the stuff because insurance forces my hand. I have huge medical bills. I have all this stuff on. I have to, like, you can't. It's always the tough part. You can't take money out of the equation, and you try to do the best you can.
Right. It's still business at the end of the day. I mean, you go into it to help people and then you're like, oh man, I have to run this thing or I'm not going to help anybody. So
is chiropractors, I mean, how much is covered by insurance versus how many?
it depends on your insurance.
Okay.
Some people get great coverage and no questions asked.
Okay. Kind of like a physical therapist would be.
Yeah, same. Yeah. And we're direct access states. So like you just show up.
Okay.
Most insurance will be fine. But I don't take any insurance.
Okay. I wonder. I didn't think you did.
No. Yeah. I provide super bills for people and sometimes they get full reimbursement. Just depends. Okay. Cool. Blue Cross seems to reimburse the best.
That's the best one. Sounds about right.
Yeah. I didn't want to.
Don't go there.
I don't want to get sued. I don't want to get sued.
For a reason. Like I don't want it in the back of my mind. Like, oh, if I did this, I'm going to put another unit on this appointment. And,
no, I'm 100% with you on not billing insurance.
Yeah.
It's a great way to live. You were in Chicago and you were different. You said you could practice differently.
Yeah. Well, I mean, like,
miss that here or like, it's fine. Okay.
I don't mind it. Yeah. No, I mean, I think as you go into chiropractic, like you got to be like honest with the opinion that like, not everybody thinks you're a doctor. Like it's fine. Right. There's some flack to it, but it comes with, like I get to fly a little bit under the radar. Like it's nice. I don't have some of the big systems. I mean, most of them don't like me, so that's fine. And I still have the rights to do what I want. What it does do is it removes my responsibility for catching those things. So like conjunctivitis, you have an internal ear infection, like not my thing. But if I missed that in Chicago, like
that'd be a problem.
I should have known.
Interesting.
Yeah.
So, okay, and we were talking about this, David and I, earlier. Explain your training process. Like, you went to undergrad.
Yep, undergrad.
And then what?
Fire up chips.
But you guys went to the same college?
Yeah, Grand Valley, though, after. Yeah. 4 years undergrad, and then chiro school's for another 4 years. Yeah, it's very similar to medical school. We just don't have the residency.
Okay, so you get like the classwork and then do you have
2 years of hard science. Okay. Yep, 2 years of hard science. Last year is all clinical, 1.5 years, basically. You still have some classes.
First 2 years of fire hose.
Yeah, I mean, like, can you tolerate the academic load? And like, it's hard. We take a lot of the same classes. We take more anatomy. You guys take more pharmacology.
Yeah, that sounds about right.
Yeah. So, I mean, I think we're like 5,000 hours in the anatomy lab by the time we're done. It's like anatomists are the only ones that spend more time.
I have zero idea how many hours I spent in the cadaver lab, but I'm sure it wasn't close to that.
No, it's wild. The first 2 years, you're in there every single day.
Really?
Hours. Oh, yeah.
That's interesting.
Did you know?
What?
This is a little shout out to. There's not a lot of shouting out to the Chippewas on their academic prowess.
Great PT program.
However, the CMU was one of the only undergrad programs that I knew of that we had cadavers.
Oh yeah.
Yeah. Our anatomy physiology, because they had just added the med school. So when I was in undergrad anatomy physiology, we had full human cadaver labs, which was unheard of in undergrad.
Yeah. So like the grad students, like, cause they have the PT school there, the grad students prep those bodies. Yep. So like when you go in for undergrad, like the body's already dissected and it's like right out, and we're the ones that do that. And they start from like fresh. They're fresh, and it's a whole thing.
So you go through your 4 years, and then you could just start practicing.
Yeah, you could just start practicing. Yeah.
There's not any like fellowship. Is there like any type of fellowship or additional training?
Program. There's lots of additional training if you want to go through and do it, but it's not a requirement. You have to pass board exams.
I was about to say, are there boards?
Yeah, 4 of them.
Okay, there are 4 boards. Okay.
Yep. And the last one's like practical in person, tons of radiology. Tons and tons of radiology. Huh. Yeah. I don't know. I think like people think we're just over there like cracking backs the whole time, and that's actually a very small amount of.
That's so fascinating.
Really, if you want to get good at manipulation, you're doing that in your off time, and like you're going to clubs. We have Motion Palpation Institute. We have Rehab Performance Club.
Where that perception comes from that people assume, is that you said it's an older model, or is it
Yeah,
Oh,
I mean,
no.
the history of chiropractic is wild.
Okay, yeah, I've heard a little about this. Can you explain briefly?
Yeah, the Palmers. Yeah, the Palmers are wild. I mean, it came from the thought that it was like alignment. So they say like, what is it? It's top down into out, and it was like it's healing. It's like healing stuff. Yeah, and it must have had some validity into what it was doing because it took off. But then Palmer got in a big argument basically with what is now the AMA, and like that split it. And that's why like DOs kept manipulation, but it's different. And then Kairos went their own way, but only the one was in the AMA. So Kairos kind of got shunned out. And it was like, that's like voodoo magnet stuff.
Even
like,
though DO does relatively similar practice.
It's just confounding the two things. It's like manipulation and like people doing weird stuff. It's like, yeah, manipulation's a tool. It works. Like it's application based, just like any manual therapy is. Like manual therapy is so hard to prove in a clinical trial because pain comes from so many different things. So I was like, how am I going to prove? I mean, this back pain patient might respond to something totally different than the next 7 that walk in my room. Doesn't mean that the manual therapy I do doesn't work. It's just application. But then it became like, all right, manipulation is chiropractic, right? And they believe that it's nervous system healing. And then it became like magnet stuff, which is still out there. I'm sure some people will swear by it. It's not my thing. And as someone uses a lot of applied kinesiology, like that rabbit hole is very similar. They're very, very similar to each other.
Applied kinesiology. Like, how would you describe it?
Oh, that's a good question. Yeah, I mean the application of movement and how the body is supposed to work. My argument now would be like it's based a lot. My thought is like it's based a lot on Tom Meyer's thought of the tensegrity model of the fascial system, right? That's holding up the framework. And then when you look back through like Pavel Kolage's work, he's the DNS guy, right? Pavel Kolage, Vladimir Yanda, Vaclav Wojta, Carol Levitt, these like pioneers in rehab. A lot of their work is based on position inhibitions. So it's like these positions or the way I'm using the muscles can actually inhibit certain muscles in the chain, right? And if I can understand that, I can understand that there's global responses that are instantaneous. So like your hip is weak on the table, or you fail an empty can, right? And I go superior labrum, boom.
Even I know that one.
Right? But I move your neck and then I recheck empty can and it is now negative.
No, it's fine. Okay.
And so it's like, well, that's not anything to do with the muscles. That's applying the nervous system to this.
It's
That's
witchcraft.
It
I
seems like
experienced it. I will never forget when you
You
walked me through this one of our first visits years ago, and like you had the blocks, and you shifted my hips. You shifted my hips, and like all of a sudden you were like, okay, now move your arm this way and then resist it. And then all of a sudden I like couldn't do it, and it would freak me out. I'm like, what? And then you moved the blocks again. Then I had great resistance, and then I'm like, what is this?
And you'll see a lot of that. I bet you've seen it too in tests and like. They're neuro tricks, but it's like, okay, those are global responses. And then it's like, well, did it stick? Like it's the same thing as manipulation. This is stiff and like a whack. And you go, oh, that's so much better. It's like, well, in 10 minutes, like, did it come back? Is it stiff again? I could do the same exact thing. Same thing there. It's like, I could do anything if I give the nervous system some input. That's all rehab is. It's like, that's really what everything is. Give the nervous system some kind of input. What is the output that it gives me? And that could be in the form of range of motion or muscular strength or perspiration or heart rate, right? My blood pressure response, they're all CNS responses. And so that's the test. It's like, all right, if I know that inhibition can come from certain things, I need to kind of like we're saying, like wash the board clean. I need a neutral environment to see what's actually causing this, or am I just treating a bunch of symptoms? If your hip is not actually weak, but I can do something to make it strong, that's great. But if it only lasts 10 minutes and I spent 6 or 12 weeks doing rehab on this hip, and it might not have anything to do with this. So I want to know like, okay, what is going on all over? I would say that's the other thing is like we're extremely site focused on rehab. I come in for my back. I only get my back treated, right? I come in for my knee. I do 12 weeks of knee rehab, whatever we want to call it, or plantar fasciitis, you name it. And I want to go, okay, well, like that's great that your foot hurts. But like, does your neck work? Does your shoulder work? Right? If it's just your foot hurts, like, is it strong? What if it's strong? then what do I do? Like, am I going to do strengthening exercises with your foot or your knee when your quad works fine? No. Or I do like 6 weeks of knee sets and quad extensions and you still have failed VMO activation. It's like, well, you better find out why the VMO doesn't work. And then you have a chance to exercise it. But if my thought is I'm just going to work it over and over and over again, and eventually it's going to get it, it's like, good luck. Best of luck to you. I hope it works.
Well, it's like from like I could definitely see obviously your desire to find the actual outcomes instead of, again, I think that goes back to some of that whole mantra of there are poor, lazy professionals in every industry, whether that's law, whether that's medicine, whether that's PTs, whether that's chiropractic. But then when you desire to be effective, you have to continually educate. And then you find out that they all start to cross over each other.
Yeah, tons.
And then you start going, okay, now we're actually getting somewhere.
Mhm.
Where the reason why I'm bringing that up is like when I tore my knee a few years, 9 years ago, I just remember the process of rehab at a very insurance-based system. Like, it was so menial to me. I remember going in there like I'm not doing like I was so above everyone else out there that they wouldn't push me. And I'm like, I found it interesting going, okay, everything you're doing right now, I'm doing at a great tactic, but I'm still what can we do to further further move me?
Yeah.
And they didn't want to do it.
Yeah. I mean, I think a lot of PT at this point is like exercise. It's exercise with some soft tissue work to it. Maybe you get some McKenzie clinicians that are more repeated motion based. But it's like, where's like if you exercise, you feel better. So I mean, you get a bunch of very sedentary people. Like it seems like, yeah, it's rehab, and they don't seem like crazy exercise. It's probably more exercise than those people have done. Most of them have done in years. Yep. And so it's like, yeah, at the end of 12 weeks, like you feel a lot better. Yeah, you feel a ton better, regardless of what you did. Like that, I'm not bashing on that. That's like kind of what the insurance model is supposed to help with, because it provides like, all right, it's like, yeah, you're frankly, you're so deconditioned. Like I need 30 visits to like get somewhere with you, right? Whereas like my thought is like train in the gym. Like you don't need to pay me $200 a session to do RDLs. So you can do that. I don't mind you paying me to do that, but it's not what I want to do. Especially if it's exercise is your thing. Whereas like I'm more interested in like, well, my knee turns in when I squat. My foot, I can't, no matter what I do, I can't feel this part of my calf. I constantly drop this thing. Like that's my job, is to go, well, this works this way, feel this moment of this, and now take it and integrate it into higher levels. And then rehab it's like the CrossFit scalables universe. And it's just levels based. So you can bring the intensity really high, and it's just like, how do I change intensity levels? But I'm looking for, so like I'm a DNS clinician. That's kind of like where we went to, like for the backtrack here.
Yeah.
So backtrack from school. So you asked about manipulation and then like further
Training,
education.
yeah.
So like I went down the DNS rabbit hole, dynamic neuromuscular stabilization. And I had a great mentor out in Chicago, Robert Lardner. And he's a PT in Franklin Square, and that dude is brilliant. And thankfully I just started taking courses, and he was kind enough to let me come shadow all the time and just follow him around. And he taught me these things, and pushed me down the DNS rabbit hole. And that all about, movement coordination. So there's a really cool website called rehabps.org. Yeah. rehabps.com. It's one of those prog school, rehab prog school. And they've got a bunch of published research on there. Because DNS exercise is special because it's not a cortical exercise. Like when we think of like, I'm going to do a curl or I'm going to do a squat, the cortex fires, right? And I use my bicep or whatever it is. And DNS is saying, okay, based on known reflexive kinesiology, right? That first year of life, especially, like those are pre-programmed movements, right? The way that I lift my legs on my back, the way I roll to my side when I pick my head up for the first time, my belly breathing in this expansion. And babies are special because they don't have all these big muscles to help move all these things. So it was like masters of center of gravity, right? They struggle with positions, but they're not just going to go wham and lift themselves up off the ground. They're going to fight to learn how to do it in an efficient manner. And then as we get older and we sit more and more, we throw kids in desks right away, throw shoes on their feet, we throw them in desks, make them sit for 7 hours, and we lose these abilities to naturally move efficiently. And so it's like, okay, if I just exercise you, I'm just going to make you better at doing this thing that you already do. Yeah. And maybe you'll trick me and you'll go, yeah, it's getting better, right? I'm getting stronger. It's getting better. It's like, cool. That's great. But are you actually using a good strategy? And then it goes back to the assessment process. Like, what is my assessment? Do I have concrete objective assessments on range of motion and muscle strength and palpation? Or am I just going by site inspection and how you feel, which is not good. Not in real rehab. 90% of, I shouldn't say that, like 70% of people, regardless of what you do, they're going to feel better at the end of 8 weeks.
Don't you love the placebo effect?
Right? Like, as long as, pat on the back, that's great. You're doing way better. You're going to feel better that day for sure. I'm more interested in the, like, I've had back pain for 25 years, right? And now I want to be able to play with my kids or my grandkids and this kind of stuff. I can't make it through a round of golf because my back is firing up and my hip hurts so bad. You're not going to exercise yourself out of that. That is happening because of the way you're moving yourself and your choice of how to do the pattern. So in my mind, that's rehab. And that's like what a lot of people that are just manipulating or just doing massage, or like I was talking to Jan about this because she asked about like dry needling.
Yeah.
And I was like, I kind of put it in the same category as manipulation and pin and stretch and cupping, maybe even like fascial stretch work, depending on the clinician that you saw. They're all soft tissue, basically, soft tissue modalities. And it's like, if it's a soft tissue problem, cool, it might work. But if it's not a soft tissue problem, and that's just a byproduct as a symptom, you're just throwing spaghetti at the wall and hoping something stays there.
It's like with my low back problem. I finally have a good hip mobility drill that's been helping me immensely. And because I always thought, oh, well, my low back hurts, so it must be low back. So then what do? You go to massage. You get a massage. You're like, oh, at the end of that, I felt great. By the next day, back to square one. And it's like, well, then that must not been the actual problem. And we all get caught up in the instant gratification side of it. And they think more massages equals better outcomes.
I think then we go, well, that doesn't work, right? Like that massage doesn't work. But it's like, no, it actually showed you that if I did that, I could get the muscles to relax and give me a chance. But then it's like, all right, now I need to stick something down to keep it. So yeah, it's like, I don't want to demonize any therapy because there's some magicians out there that like, you go see them and you think they're talking a bunch of BS and they do one manipulation, you feel better and it just stays. And you're like, I don't know why. But most of the time it's not that simple. As Robert would say, my mentor would say, it's like there's no magic button. There's like many, many buttons, and the order you press them matters. Right? Like, yeah, if I'm trying, and you probably see it a bunch too, like my number one thought, if you have raging inflammation, like it does not matter what I do. Even if I have the best therapy in the world, like I am not going to settle your back down if your blood sugar is 150. It's what it is. So it's like, I need to be able to go like, this is symptom management. Yeah. It's like system management, right? I need to go, this is an inflammatory pathology that's occurring right now. And because of that, the inflammation is going to guard all of the input that I give, right? It doesn't matter if I massage it, it's already hot and inflamed, right? If I try to move it, movement should help, but if it's inflamed, it's not going to matter. It's not going to matter. Yeah. So it's like, don't demonize
one thing.
Because
it didn't work for you the one time.
Yeah, exactly.
I agree with that. No, I know
he's really smart.
It was just like,
I've tried a lot of different. I mean, I was hurt for a long time, and it was like exercise wasn't going to do it. Like my hip hurt and my shoulder hurt, and if you spend enough time with like crazy gym people, just telling them not to squat or press like isn't going to happen. So I was like, I'll just deal with my hip and back hurting. Like that's fine. And then Robert showed me like it was not that I wasn't working hard enough. It was actually I was working too hard on everything. And I was using all these big accessory muscles to accomplish tasks. And because I would improve over 6 or 12 weeks, I thought that was improvement. And he's like, no, actually, you still fail all of these tests. Like if I lay you on the table, you can't hold your head up. You can't hold your leg here. If I put you in this position, I can twist you around and push you over. And he's going, this is the nervous system saying, I'm just
freaking out.
I don't know where I am. right? And you can see it once you see it enough, it makes sense. Like you say, like if you watch enough birds, like it's pretty obvious when one's flying backwards.
I feel like convincing people, at least on my side, convincing people it could be nervous system related is challenging. They want the MRI to show something or whatever. So how do you explain that to people?
Yeah, I don't suggest imaging.
Right.
Yeah, I would tell people not to go get an image before they see me. Yeah, I don't want it in your mind, like regardless of if your shoulder's destroyed or you got low back problems. Like, one, if you get an image, like they're gonna find something.
Uh-huh, right.
Yeah, disc bulges, degenerative disc, and they all
Uh-huh.
sound so good on radiology reports. So, like, really helps your spirits. And we just know it doesn't matter. Sure, sometimes, but overall, when we look at outcomes like injections, surgical outcomes, like they don't support.
And I 100% agree with you. When I feel like we're taught in medicine that, well, if someone's coming back and over again, it's chronic. They've tried PT and it doesn't work. Then like you have to get imaging. But like I just did this for a patient. She like wanted this MRI of her shoulder, and I was like, I know it's not going to show anything, but she did feel so much better that it showed nothing.
Sure,
But it's like
cool.
I hate that we feel forced by our patients to do this because that's kind of the narrative in society that imaging, if you don't, your doctor's a bad doctor.
Yeah.
That's how I feel.
Yeah, no, I agree.
So I really think that's not as necessary as people think it is.
I've definitely referred people out for imaging.
Yeah.
Like it's not my first step. Like I said, I don't want I treat a bunch of knees and low backs, and someone looking at a disc bulge or stenosis on their just like one of the worst things for patient care. Because then you could show them either way, and you're like, look, this is your pain level's down, you're stronger, your mobility's better, and they're like, I have stenosis. You're like, who cares what the stenosis says? Like, we're going by symptoms. Like, so yeah, in knees especially, like a meniscus nick or like a tear and something like that. Like, I see a ton of knees that don't need meniscus surgery. Like, they're low back referrals, they're tight feet and calves, and they clear out fine. But as soon as you see that, like, we'll get you in for that quick.
By the way, the other one, speaking of feet, Dad now is a huge advocate of wide toe shoes. All he wears is the flat, like rubber soles. Occasionally he's got a swap, but I would say half of his day, if not more, he's in wide-toed shoes. If a conservative cardiologist can switch up his ways, I think anybody can.
I have a couple of those. But I will admit, they're just not as attractive usually. That's my problem with them. They need to make them look better. But I'm sure they do help.
Yeah, it's hard to find a good looking pair. Vivo makes some good ones.
I have Vivo.
Yeah, Vivo makes some good ones.
But they still gotta improve.
The barefoot stuff, same thing. Oh man, yeah, you're going.
Yeah, the barefoot.
Yeah, it was. I mean, we saw all the barefoots come out, and then what do we have first thing? Like fractures, tons and tons of foot fractures, tons of them, because you just couldn't handle it.
Well, I talked to some health recently, and they said the shoes are really good, but our feet are not.
We don't want to use them.
To them.
Yeah, we don't want to use your foot. Just because you get the mobility back doesn't mean you can use your foot.
So do you tell people to wear these types of shoes then?
I'll test shoes.
Okay.
In the office. That's like same thing. I'm sure some people think I'm full of it with the applied kinese for that. But it's the same thing. It's like, all right, it's input. Like the shoe on the bottom of your foot is input. You're taking in a ton of proprioception from the ground all the time. Mostly it's on clouds I pull off of people.
Interesting.
Yeah, all day long. Like, I've not met a person that tolerates that shoe very well. Yeah, and it's checks up the chain. It's not like, oh, I think that one doesn't look good. Like, it's not a good shoe. It's like, okay, well, when you put that pair of shoes on, like, I can push you around, and it's easy. And when you don't, or when you wear a different pair, like you're stuck to the ground, or you're strong again. Yep, your trigger points are back. Yeah, and I think it's still just it's an assessment process. Like, no matter what therapy that you apply is, you have to have a set of tests that are trustworthy to say, like, did I do anything or not? Right. So whether it's like a medication or soft tissue manipulation or a different pair of shoes, it's like, how am I rechecking to know that my therapy was effective? Or at least like didn't make anything worse. And even then, like, sometimes I'll take worse because it's some clues at least.
That's true.
To say, like, all right, well, if that made
That
it, I haven't made
right.
anything better, but I can make it worse if I do this. Like, at least now I have something to go off of. And because of my other checks, I know not to repeat these things. And I can do my thing and move on.
I know David and I sometimes get annoyed with certain at the beginning. certain, it's not just chiropractors, but
No,
sometimes
it's
chiropractors online who are, it seems like sometimes going beyond the scope of what I would expect a chiropractor to do. However, you did tell me more about education. So it seems
Yeah,
like you said you could almost practice internal medicine in other states.
yeah.
So you're saying there's a very broad,
Let's go. I mean, it's like anything else. Like I would use gut biome as my
yeah,
best example. There's a ton of gut biome experts. Like whether or
just
not they are an expert, it's kind of up to you. Like you got to figure it
sure.
out.
It's always my favorite. In particular, I've always found the gut microbiome ones where it's like every PhD researcher that I've tried to learn from that talks about they that's what they study. They all say the same thing. We know nothing.
Yeah, we don't know.
So then,
That's
like,
so
if the
true.
researchers who are doing it say we know nothing,
Yeah,
I have a hard time believing some random guru is
They're the one.
they're the one.
yeah.
That's always like my go-to yellow flag, red flag. It's like I'm a professional in gut microbiome. Well, if that means limit hyper-processed foods and eat more whole foods and fiber, great. Like, cool. But when you need this specific thing that I happen to sell. Yeah, that I
Yeah.
get 5%. And that's always. Now, how do you define that? Because obviously, and we don't have to go into details. I absolutely respect your general narrative, which is everything has its place. And massage therapy isn't for everyone, but in the right modality, it's there. There's people out there doing incredible things. Like a whole different pivot on that was my mom. Did you know my mom used to be an oncology nurse? Hospice and oncology back in the day. We had a neighbor who was going through end stage cancer, was like in the process of dying. Like this was it. She had done everything. And she was literally on a morphine pump at this point, just systemic pain, nothing works. And mom was there, she was at home, so she took her to appointments because no one else was around, and mom was like, yeah, sure, I can do that. She watched her go and do needles, acupuncture, and she watched this woman who was on a morphine pump with a pain of 13 do acupuncture and then be down to Tylenol and a pain of 2, and then it would slowly come back. But it was like mom was like, I think it's foo-foo, but it's like I watched that. I was the one that dealt with her morphine, and like watching that, I don't know how to explain it.
I think the more you're in medicine, the more you see those things.
Yeah.
Like, Vojta. If you've never seen Vojta therapy, Vojta, Vojta. It's Vaclav Vojta was a pediatric neurologist in the 70s. I think it's 70 that they sent him to the sanatorium with all these kids with CP. And we don't know anything about CP. So so he's like, all right, like, I'm just gonna, like, they're all stuck up on their toes. He's like, I'm just gonna push you down and like see what happens. And they just crumple to the floor. And you're like, oh, and then he'd like shove their head down and their feet would flex. And he'd be like, huh. But then it's like, oh, it's not random. It's nervous system responses. So then it became reflex stimulation. So you treat infants with central nervous system problems with Vojta therapy. You can treat anybody with Vojta therapy, but that's like shoot disorder, like some of these bad Guillain-Barré, like things that you can't really load the joint. You can still drive muscle activation around the joint with this therapy. But you read it and you watch it and you go, voodoo. For sure. And then I saw a kid get treated in Columbus, 6-year-old little boy with cerebral palsy, non-auditory or no speech, can't crawl, like knee walks, and his hands are stuck. And by the end of that weekend, he put his hands on the ground and crawled across the floor. Right. And you're watching this happen, and they're screaming, and you just hold them down. You hold them down in these reflex points, and you're stimulating, you're watching for the muscle activation to occur, because it's the same DNS principle, that it's a deep brain pattern that drives the synergy of the muscles. And like, what are you going to do? You tell this kid how to exercise and straighten his arm out? Like, it's never going to happen. But you watch him like try to support, and the shoulder blades set and the hands start to open, because this is an infant. It's a brand new baby. Ulnar deviation, thumb in the fist, is a 4-week-old. And so CP is like a stroke, you're reverted back into immature patterns. I'm a baby again. But CP, I never escaped it. Right? This is protective. This is an injury. If I tweak my shoulder doing a muscle up, and then I hold it in elevation, internal rotation, right? Because it's an immature pattern, extension, elevation, and internal rotation. And as you grew and got more control of the nervous system, I relaxed. I got belly breathing, the spine straightened out, the hips torsion started to occur. And it was all deep brain activation. So you watch that and you're like, voodoo, no way. And then you that kid get treated like that, and you're like, I know nothing. Nothing that I've ever learned matters anymore. I've watched tons and tons of infant rehab, and you see that in like a weekend, and you're like, this should be in every
Yeah,
hospital.
why isn't it generally known?
Yeah, but it's the same thing. It's like it's so hard to prove in a clinical setting because the application is so crucial. Like the skill of the therapist is so crucial. Like if I do it on you, I'm okay at it. If like one of the prod PTs do it on you, it's not close. You feel the muscle synergy actually happen in the breathing, and there's no explanation for it. But their understand it. So it seems like magic, but their understanding of the kinesiology, that's applied kines. It's like what the understanding of like, this is how the framework works. And I can see dysfunction in the pattern at these points. And I know what muscle activation should drive these things. And then you can use the therapy extremely effectively. But we're in a clinical evidence-based time frame of medicine. Yeah. It's like, if I can't prove it in a clinical trial, that's BS. We're not doing it. Yeah. And like, you're throwing away a ton of therapy that's extremely valuable. And then you're getting people that are mishandling it, and they're using therapies that really don't do anything, and they're making a ton of money from it.
Right. Because I 100% agree that there's things that we don't do because we're evidence based, but then it's knowing how do we go outside of that and pick the right things.
Yeah. And it's so funny because like the unfair angle to this is it seems that physicians do get more respect on going out of evidence-based and no one questions it. The reason why I say that, off-label medication use. Something hasn't been clinically proven in it, but physicians know, hey, yeah, and this they do things off-label and no one questions it. But like, well, again, it's been
It depends on what we're doing. Some things people do criticize from off-label use. I think there's certain things that are just more people have done it for so long that it's off-label and it seems normal. But I mean, I'd say when I went through training, it was very much like we do evidence-based medicine. We have to do evidence-based medicine. So that's burned into your brain. Is that the same way?
Yeah, there's time of manipulation.
If you're not doing evidence-based.
Well, here's the question. I didn't even ask this before. When you did your 2-year fellowship in integrative medicine at AZ, did other physicians at your previous practice know about that, and did they say anything?
So honestly, I didn't really tell people I was doing it because I was afraid of the pushback. People would be like, that's stupid. That's like, that's no real medicine. Like I was truly not afraid, but like, I was like, I'm not going to like go tell people this.
It's worthless to tell people because it's not going to change my judgment.
Exactly. So I didn't really share it.
I think it's just education and information gathering. Like there's so much information out there, and like to think that I've got it figured out, and like, good luck. Like next week you're going to get a patient. Like you don't know anything.
Yeah.
If you're asking the universe for it, you're going to get one then.
And I think that's so true. I think that is what you want to hear from your providers, that we don't know everything. And that's what and if you have someone that says that they do, then I would not go to them.
I guess, and that's a good pivot point because I do want to have this subject on like, where do you see the yellow flags? Let's just say in chiropractic, because that's your world. Like, obviously, red flags is a little like yellow flags. Like, hey, they could be doing the right process, but I'd be careful. What are the types of things that, from your world, knowing everything you know, if someone is telling you, "Hey, I'm about to go to this person," these are the things you're saying, and you're like, "Ooh, I'm concerned they're going to be giving you the right information."
A general rule of thumb is like you should have some improvement in symptoms in a couple of visits. If you're the same after a few visits, like something weird's happening, or they better have a pretty good explanation for it. If your treatment plan tends to max out all of your insurance contributions, that's a pretty good call. The treatment plans seem to fit those timelines, especially if you feel pretty good halfway through. Like I would think about those things. I am not an imaging fan. Like in the beginning, I'm yet to see. I mean, you hear it all the time. Like I went in, I got an image, I have these things, it's this turn, yada yada, and all these lines on the thing. And where's the second image? Where is it better? Like, show me. Like if you've been going for 10 years, like,
That's so true.
so where's the next image of it? It's like, oh, we didn't need to recheck it. No, it's
So
like,
you,
sure, okay. Like those
do you
are,
need X-rays in your office?
no, we're not doing X-rays in our office.
Great.
No, I'll send you down here if you need an X-ray. It's fine. Yeah, and I'm thinking like, unless I'm worried you have metastatic disease or some kind of terrible fracture, like I don't care about your image
Yeah.
anyway. Just ankle sprain, like most of them walk in anyway. They're like, I'm afraid it's broken. You walked in here and it's like, yes, you're limping bad, but like save yourself the $300.
And like when someone's got a true rotator cuff tear, you don't need an image to tell you
No,
that.
you know right away. Yeah. Yeah. And there's pretty simple tests. I mean, if I move your neck and your shoulder gets better, I'm not worried about imaging your shoulder. So,
Though I will say, if I have tried to refer people to ortho who obviously had a full rotator cuff tear.
oh, they
Did
send them
I do a MRI? No, but will the ortho see them without an MRI?
no MRI. Yeah, the insurance.
So that's the frustrating part
Wait.
too.
You have to go through the
Insurance dictating how medicine works?
Yeah, it's wild. Yeah, and I think it's just like how is your clinician checking things? Do they seem like they have a system of actually checking, or are you doing the same things every time? You get manipulated the same thing every time. I'm doing the same cupping and like banded exercise every single time. It's like, okay, like I want a little more from this.
Sweet. Well, do you have other questions, David?
That was fantastic. It was a
Yeah.
fun episode. I mean,
Yeah, I appreciate you
I-
guys having me on.
well, my whole thing is it's just clear that you're passionate about helping people because the amount of different modalities you've dove into in the last 15, 20 years of doing this tells you that wait, how old are we?
I'll turn 34 in a couple months.
Oh, you're a child. You're a
Yeah.
child. You're such a munchkin.
You're my birthday month, aren't you in March?
I'm August. I just turned 34. That's what I'm saying. You're a munchkin.
Baby. Yeah, baby. Still youthful. No, and I'm just looking for information. I think it's so much fun to learn stuff, and it's great to be proven wrong. And like, I love that so much. I want an explanation. I want you to make it make sense to me. But like, I'm willing to listen. That's fine. I've seen too many therapies that I thought were nothing. Help people, and if that's the job, like help people.
Yeah.
Yeah. I don't care what you do. Help people.
Where can people find you?
Yeah. So I practice out of Paradigm Sport and Spine right here on Fulton, right outside of Ada. You can find us at our website, beparadigmfit.com. I also practice out of Great Lakes Spine and Sport out in Holland. GreatLakesSpineandSport.com. You'll be able to find it pretty easily. And then we got social media and all the things.
Well, if anyone in West Michigan needs help with something that you know where to go now. Thank you.
Absolute pleasure. Have a good one, guys. Perfect.